Excellent. Welcome, everybody. Welcome, welcome. It's great to have you all here. I want to invite you to start today by taking a slow, deep breath. Breathe in and pause, release. We have an hour together. And we want to start by calming our nervous systems with some deep breathing so that you're really open and receptive to absorbing this information, because there's a lot to take in the next hour. Quickly, I want to tell you about the Powerful Project, who's our host today. It's the mission of the Powerful Project, that was a mouthful, is to support teens and young adults who are stuck in the middle, who don't have access to quality support, whether it's through financial limitations, lack of health insurance, high deductibles. It's about making a mindful match, providing resources and services to support the mental health of individuals. And I can attest to how much effort and love and commitment the team at the Powerful Project puts in to making placements that are really a good match. We want to remind you, while this event today is free of charge, we want to invite everybody who's listening, whether you're here alive or listening later, to please make any contribution that you're able to the Powerful Project. All donations go directly to support clients and individuals. The organization is 100% volunteer run. And if you cannot donate, but you have a wonderful skill that you can help with, you can reach out to admin@powerfulproject.org. We can always use help with fundraising, marketing, PR, outreach, grants, sponsorships, etc. So just a reminder, you can Venmo @powerfulproject99, or go to the website powerfulproject.org to make a donation today. And we'd appreciate that. And we'll put that in the chat in a little bit. Really quickly, my name is Elaine Taylor-Klaus. I'm here today as your moderator and MC. And I have a resource called impactparents.com. So I do my work in the world also virtually, supporting, training, and coaching parents and professionals of what I like to call complex kids. I suspect we'll be talking about some complex kids here today. And so I collaborate a lot with Lauren. We've known each other and collaborated with each other for decades now. And I'm happy to be here as a moderator and an MC to support the organization and to support the work. And because this topic has a particularly near and dear place in my heart. Lauren and I were joking before you got on, Elisa, that she and I met many, many years ago. We were trying to address the nutrition at our kids' school, and started taking a nutrition class together. And so the two of us, this topic goes back for us decades now. Let me go ahead and get us started and introduce our speaker. Our guest today is Dr. Elisa Song. She is an integrative pediatrician, a pediatric functional medicine expert, and the mom to 2 thriving children. In her integrative practice, which is called Whole Family Wellness, she's helped thousands of kids get to the root causes of their health concerns. And she's helped their parents understand how to help their children thrive, in body, mind, and spirit. By integrating conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. And boy, do I wish you were around when my kid was a kid 30 years ago. Dr. Song created Healthy Kids, Happy Kids, which is an online holistic pediatric resource to help practitioners and parents bridge the gap between conventional and integrative pediatrics with an evidence-based pediatrician-backed approach. And when this is over, with your permission, I'm going to introduce you to my daughter, who's going to medical school and wants to be an integrative pediatrician. So,
oh, absolutely. We need more and more. That's awesome.
We do. I'm so excited to know you. So welcome. Thank you for being here today. I'm going to turn the floor over to you and invite you to lead us in a conversation about the brain and the gut and how they're connected and why that matters.
Great. Thank you so much, Aline. And I really want to also thank and appreciate Lauren for inviting me here. We've been trying for a little while to get this scheduled, so I'm so glad it worked. And I'm honored to be here with all of you. I know this will be recorded. I'm going to start off with saying, this talk is can be a very big talk. In fact, for practitioners, I train pediatric practitioners in the gut-brain, mind-body connection in an all-day training. So we're going to distill it down to an hour and know that there is so much more. So this is just kind of scratching the surface. But for those of you who are less familiar with the gut-brain connection, or want a little refresher on how to really make it practical, because I'm also not just about the research. I'm a clinician and I'm a mom, and I want to make sure that everything is actionable and doable. I'm not going to recommend anything that isn't doable.
I'm stepping back on for just a second because there's a little bit of a sound quality issue. And so I want to check in, if you will, before I'm going to pause the recording for a second. Turn it back on. Okay, thanks for that. And I think we got our tech issues resolved, and please take it from here.
Okay, we are back on and ready to go, right? In life, we sometimes just need that reboot. And so we had a little reboot. Let me go ahead and share my slides. And as I was saying before, this is a huge topic that I really tried to distill down to about an hour of time that we're here with you. I'm going to leave some time for Q&A. I'll also be monitoring the chat in case some questions come up. So just let me know. Happy to answer questions. All right. So we are going to discuss, I'm seeing, sorry about that. I'm looking at it. I'm seeing the waiting room. So got a little distracted there. Let me share my screen.
We can see your screen, but it's still in the format. If you press the down on the bottom. Do you know how to do it so that it shows as just the slide?
Is this okay now? Do you see
No,
everything?
we lost you. We lost it
Okay.
now.
I'm sorry, the weather here, it's not quite, we're having our atmospheric storm coming, but
Lovely.
I don't know, atmospheric river. I'm not sure if that's what's causing the tech issues, but hopefully, is the slide up now?
That's better. There we go.
Okay, great. Okay. All right, guys. Always, right? Through the past 3.5 years of Zooming, there's always a tech issue that comes up. So
it's all
right,
good.
we're going to talk about the gut-brain connection, mood, and mental health. Elaine already told you who I am, but these two are my best teachers. I mean, they teach me every day, and really honored that I can share my knowledge with you, not just as a pediatrician, but as a mom. And I will fully, if you follow me on Instagram, I'm not afraid to share my mom moments, and I don't want to call them mom fails, but mom lessons, right? Because nobody out there is quote perfect, and we just do the best we can for our kids and for ourselves. So I do integrate. I'm an integrated pediatrician. So what does that mean? It's not one or the other. I'm fully trained in conventional pediatrics. I went to Stanford as an undergrad and NYU Medical School and trained in pediatrics at UCSF. So I have had all of the conventional training. And yet we know that there's a limit to what conventional pediatrics can do for our children. Conventional pediatrics is amazing at putting out fires, right? Squashing inflammation with steroids, dealing with trauma, really helping, killing bugs with antibiotics. And yet now we're understanding, well, we need to really have a focus on helping children thrive. And helping children thrive means building that foundation of health and wellness, mind, body, and spirit. And so I integrate conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. And we're not going to dive too much today into the integrative treatments, how I might use acupuncture and oils and homeopathy for anxiety and mental health concerns, because that is another huge topic. But, I just want to let you guys know that there are so many different ways that we can, whether or not you're on medications, we can support and enhance the outcomes that you would like for yourself or for your children. All right. And just as a disclaimer, none of this is intended to be medical advice. It's intended to be information, intended to be inspiration. And so, I always want to make sure that whatever's going on, whether you're taking different herbs or medications or different supplements, that you just integrate the information I'm sharing in a mindful, knowledgeable way and enlisting the support of your practitioner. All right, we know that mental health is in a state of emergency for our children and for us as adults. The pandemic has really shined a spotlight on that. But this is not a new epidemic, sadly. I am hoping that the pandemic is an opportunity to open that discussion for more public health interventions, more organizations like the Powerful Project really stepping up and providing the needed services and not just paying lip service to this. Long before the pandemic, we know, for our youth have been in crisis. And sadly, anxiety in our teenagers, and this is before the pandemic, 1 in 4, 25%, 1 in 4 had an anxiety disorder. 1 in 15 would have been described as having a, quote, severe anxiety disorder. And as I see the preteens and the teens in my practice, it is almost an expected rite of passage that I have anxiety or my friends have anxiety and they're on medications, so I should be on medications too. It's just the way that life is now. And it really shouldn't be, and it doesn't have to be. Depression also has been on the rise. And these are numbers before the pandemic. So I'm sure these are worse now. 1 in 15 teens before the pandemic was diagnosed with depression. And by the time kids are 18, almost half of them will have any mental health disorder. So we need to wake up. And this is not even to discuss the epidemic of suicides, in our youth, and adults, but in our youth, teenagers to young adults, in the early 20s, suicide is the second leading cause of death. Only second to accidental injury. And accidental injuries, we know, can often be a result of mental health concerns and risk-taking behaviors. And when we're trying to put this into perspective, our youth are 27 times more likely to die by suicide than influenza, right? So we need to really think about where are our public health priorities. And I'm so glad you're here today to really understand there's more that we can do. So what I'd like to have you come away thinking about is whether anxiety, or let's insert any mental health problem, depression, ADD, behavioral concerns, OCD, ODD. I mean, all of these initials, right, that now are being kind of slapped on our children. Are those a brain problem, or are they more than that? Are they maybe a gut problem? So let's talk about the gut-brain connection. Many of you have heard of the vagus nerve. And as we started, and Elaine said, let's all start with a slow, deep breath in and a slow exhale out, slower on the exhale and holding on the bottom. That is supporting our vagus nerve. Our vagus nerve is that information superhighway between our gut and our brain. And it's bi-directional, meaning that the communication happens from the gut to the brain and the brain to the gut. Now, what most people don't realize is that 80 to 90% of the communication occurs from the gut to our brain, right? So who is really in charge here? Who's giving the orders? Is it our brain or our gut? In fact, our gut has its very own nervous system called the enteric nervous system. Our enteric nervous system can live without our brain. Our brain cannot live without our enteric nervous system. Right? So it really is food for thought. And so you can't not open, a journal. I mean, I guess now it's scroll through your news feed, right? Nobody has an actual paper anymore. But, in the old days, we had newspapers that came every day and magazines that we would flip through. And nowadays, on virtually every day, there's a new article on the gut microbiome and the impact on the brain and the impact on cognitive decline and on sports performance, and you name it. So what exactly is our gut microbiome? Well, inside our gut microbiome is housed our microbiota. And we have trillions and trillions of microscopic organisms that live in and on us, in particular microbiomes. In our gut, these beneficial microscopic organisms are called probiotics, which most of you have heard of, right? You go to the store, you pick up a tub of yogurt. Live Active Cultures has probiotics. Some of you may even be taking probiotic supplements. Now, the microbiome is a community. It's an ecosystem of those bugs, in that particular microbiome, and that interaction with our host, us, right? We're the hosts of these bugs, right? And our genes. Now, as hosts, we have to have full respect for the fact that there are more microscopic organisms, more bacterial and microscopic organism cells in and on us than human cells. So who are we living to serve, right? And we have microbiomes in virtually every single organ system. So we think of our gut microbiome, but we have a microbiome on our skin. We have a microbiome on our eyes that are different. We have as women, a vaginal microbiome that informs, if our babies are born vaginally, how our baby's gut microbiome starts off in life. And we have a gut microbiome neurotransmitter connection, a gut-brain connection here. What we want to make sure to understand is that 90% of some of our neurotransmitters are made by our gut bacteria, those probiotics, up to 90%, maybe more. So are those neurotransmitters brain chemicals or gut chemicals? So 90% of the serotonin in our body is made by our gut bacteria. Serotonin, as many of you know, is our feel-good neurotransmitter. It helps us relax, manage stress. It's a precursor for our sleep hormone, melatonin. Imbalances in serotonin can show up as irritable bowel syndrome, as anxiety, as depression, as OCD, as any host of gut conditions. Dopamine, as some of you know, is our reward neurotransmitter. Keeps us motivated, on task, focused. So when we have problems with attention and focus or addictive behaviors, that can be a dopamine concern. Acetylcholine helps with processing and isn't implicated in neurodegenerative conditions like autism and Alzheimer's disease. GABA is an amino acid, a neurotransmitter that helps with calm and stress response and anxiety management. And norepinephrine is involved in our stress response. Now, I'm going to take a step back and talk about stress, because stress in our society has become a 4-letter word, okay? And stress is simply the physiologic response that your body has to something about to happen, right? And so it's not good or bad. And in fact, we need a certain amount of, quote, stress to perform and survive optimally. So, we don't want toxic stress. We don't want unmanageable levels of really high stress. But one of the things that we want to be aware of is that, for us as adults and as parents, one of the most common mechanisms, I wouldn't even call it a tool, but common mechanisms that we have learned to cope with stress is avoidance. We've deemed every single form of stress bad, and we don't want any stress. And by that token, we don't want our kids to ever be stressed. Well, we have to realize that when we have a little stress, and think about it, a work deadline, you're running late somewhere. I mean, when you have, or, we've had this experience when you go to a restaurant and you're the only one there and there's, five wait staff and you're like, wow, this is the slowest service ever, right? Because there's not a lot of impetus to kind of get on the ball, right? Whereas if it's crowded, you're like, oh, this is really super, super fast. And same thing, if you have a deadline, you get focused, you're in the zone, and you get stuff done, right? And there's something called a stress performance curve where it's a bell-shaped curve. So here, and this is performance, okay? When there's not a lot of stress, let's say hardly any stress, what happens is we don't perform well. No deadline, why should I bother trying right now, right? Everybody wins in soccer, why should I try hard, right? And so when you're in this level of no stress, we become apathetic, indifferent, bored, and we can develop more anxiety from that. We have an optimal level of stress where we're performing at our peak. This is what people call in the zone, right? Where we are focused and we're on. And then we have too much stress, where then we get wired, tired, anxious, irritable, right? So we want to make sure that we understand every time we overcome a stress successfully, our body and our brain understand how to do it the next time. Now, when we're in that stress state though, if we can breathe, slow down that fight or flight response, we can activate our brain better, right? And we're going to talk about that in a little bit. Oops. All right. So there is a term called psychobiotics that was coined, I don't know, I mean, decades ago. And these are the probiotics that support optimal neurotransmitter production, like serotonin and dopamine and GABA. These psychobiotics, these beneficial bugs that specifically support healthy neurotransmitter levels, have been found to reduce inflammation in the gut, reduce inflammation in the body and the brain, and in fact have been shown to be effective at treating symptoms of depression, anxiety, and other psychological disorders, and help us manage stress and our stress hormone cortisol better. And in fact, in one of the studies, these psychobiotics were found to be more effective than an antidepressant medicine called Celexa. And there are studies looking at, the power of, exercise in nature as being more effective for mild to moderate depression than SSRI medications. So it's not an either or. But for many people, many children, we know maybe an SSRI, Lexapro, Prozac, whatever, it helps initially, right? But then after a while, it might start losing its effect. And so we want to make sure that whether or not we're on medications, we are doing everything we can to support our child's, our brain's ability to, overcome the anxiety or the depression or the mental health concerns that we have. So that's, if we have a healthy gut microbiome, we're going to have healthy neurotransmitter levels. But what happens when your gut microbiome just becomes disrupted? And what disrupts our gut microbiome? Well, food is medicine. That's what we're going to be talking about today. But the wrong foods can disrupt microbiome mischief makers. And I'll show you what some of those are. Medications can disrupt our gut microbiome. And antibiotics are the #1 major disruptor of our gut microbiome. Now, why is that? Because antibiotics, and when you need antibiotics, yes, we want to use them. However, we know we are heading towards a public health crisis of antibiotic resistance because antibiotics are not being judiciously prescribed. And in fact, in some studies, up to 75% of children are inappropriately prescribed antibiotics for viruses. And we know antibiotics only kill bacteria, they don't kill viruses. And so when they're necessary, or even when they're not necessary, antibiotics, yes, they're going to kill the bad bugs, like maybe in your sinuses or in your kid's ears with an ear infection. They don't care what they kill, though, in terms of bacteria. They can wipe out all the good bacteria in your gut as well. They don't kill viruses, they don't kill yeast, which is why for many women, they have that experience where they take antibiotics, it wipes out the bacteria in their vaginal microbiome or their gut microbiome, and all of a sudden they have a raging vaginal yeast infection because the yeast they're having a heyday, right? There's no more bacteria to get in the way. They can grow and flourish, right? But other medications like NSAIDs, ibuprofen type medicines can also harm the gut microbiome. Reflux, antacid medications can, steroids, and oral contraceptives. So for our teenagers with anxiety or depression or mood concerns, and they're on, a low-dose antibiotic for their acne, and they're on an oral contraceptive, a birth control pill, and their anxiety is not improving, and they're getting more and more depressed, and they're not managing, we have to think, well, what role are those medications playing? Not that we want to necessarily take them off of those medications, but we need to understand, all right, if it's disrupting their gut microbiome and that's perpetuating and exacerbating, aggravating their mood concerns, how do we support their gut microbiome, right? So they can get the benefits of the medications that they might be on without the unintended consequences. And psychological stress within, 2 weeks, less than that, can change your gut microbiome, can change the bacteria in your vaginal microbiome. So it's kind of a chicken and egg thing, right? We need to manage the stress, and we also, the toxic stress, the psychological stress, and also support the gut microbiome. And it's synergistic too. When you support both, you up level both of them. All right. So these are just some studies looking at Antibiotics. Now, in this particular study, treatment with just one round of antibiotics significantly increased depression and anxiety with all the different kinds of antibiotics that were tested. And in this study group, the more antibiotic courses they had, the higher their risk for depression and anxiety. This other study that looked at the antibiotics in toddlers, right, given to toddlers, and in some studies, up to 70% of toddlers by the time they're 2 have had at least one round of antibiotics, most commonly for ear infections. So, which is why I love using an integrative approach, because there's so many natural ways we can support and treat ear infections without needing antibiotics. But if your child has had antibiotics in the first 2 years of life, and then there's also a family history of mood concerns, they may have an increased risk by up to 50% of certain mental health concerns, including sleep problems, ADD, anxiety, behavioral concerns. So now some of you are thinking, oh my gosh, my kid had antibiotics, and oh my gosh, is that why they're having trouble in school right now? They have anxiety, they have OCD. We can't ever go back in time and know for sure, right? It's a factor. And this is to say that if your child has had antibiotics and they're having mental health concerns, look to the gut. This is meant to educate and empower, because we can heal a disrupted gut microbiome. But the first step is knowing that it could be disrupted and knowing that that could be playing a role. So finding a practitioner who can help support, looking into your child's gut and healing whatever disruption has occurred. And it's never too late, right? Ideally, the younger you start, the easier it is. And it may take a little longer, it may take a little bit more doing when your kids are older, or if you as an adult, you're thinking, oh my gosh, I had strep all the time when I was a kid, or I had antibiotics, and I probably had 20 rounds of antibiotics by the time I was a teenager. Could this be it? Maybe, and yes, you can heal your gut. It just might take a little longer, but know that there's hope there, and it's possible. Otherwise, I wouldn't be doing the work I'm doing if it were all doom and gloom. Okay, so how do we then establish a healthy gut microbiome? Now, in this moment right now, what we want to do is think about food is medicine. What are the right things that we want to support your child's gut microbiome and gut-brain connection? Now, I mentioned probiotics, right? These are the mood boosting buddies in our gut. And remember, 90% of the serotonin in our body is made by our gut microbes. So these are some of those psychobiotics I was mentioning, these particular strains that have been shown to reduce anxiety and depression, work better than some antidepressant medications to support anxiety, depression, cognitive decline, and can also, this PS128 strain can help with attention and focus. And there are some really interesting studies for kids and adults on the autism spectrum. So, and fermented foods are probiotics with a punch, right? Fermented foods are foods that contain probiotics. This study looked at 710 adults, a little over half were females, who had social anxieties, and found that those patients who consume fermented foods more frequently had significantly less social anxiety. So the conclusion is that consumption of fermented foods that contain probiotics may serve as a low-risk intervention for reducing social anxiety. So if eating fermented foods could help with your child or your social anxiety, wouldn't that be worth a try, right? Now, I put here, what are some examples of fermented foods? There's yogurt. Now, a lot of people are sensitive to dairy in my practice. But there are other non-dairy options like coconut yogurt, almond yogurt, cashew yogurt. But yogurt, fermented, means it's been cultured with live probiotics and are rich in probiotics. Kefir is a drink, made with live cultures. There's kombucha. There's, an explosion of kombucha options available. So yes, kids can drink kombucha. Yes, adults can drink kombucha. Kvass is it's a fermented drink made from vegetables. A lot of, most commonly beet kvass. There's sauerkraut, there's pickles. Now, when you buy pickles, just know, look at the jar. True fermented pickles should not have added vinegar. Right. So the most common pickle that's out there has vinegar in it. Right. But there's bubbies. It just has salt and water. It's brine, that makes that. We've actually made, I had in my kids' 3rd and 4th grade class, I had the opportunity to teach them all about their gut and their gut brain and gut body, gut immune system connection. And we did tons of hands-on activities, including making kombucha and making sauerkraut. So fun to do. I love making kombucha. It's one of the most fun things you can do. I mean, we had a blast doing it. But miso, natto, tempeh, kimchi. I mean, I'm Korean. I love kimchi. But kimchi also has really good immune boosting benefits. In fact, there's a kimchi research institute in Korea looking at these benefits, because kimchi has been found in vitro to kill, the H1N1 flu virus and lots of different really pathogenic respiratory infections. Now, some of you are thinking, well, there's no way I'm going to get my kids to like fermented foods. So we will, yeah.
I just want to clarify something, because I heard you say that pickled should not have vinegar, but then I see apple cider vinegar. So can you just clarify that?
Oh, that's a great question. Okay. Yeah. So pickle. So when you ferment a food, you basically make a brine with salt and water, and then you put the vegetables in, like, let's say shredded cabbage or cucumbers. You cover it up completely with that brine, and you let it sit, and it ferments, and different bacteria will grow in there. There's probiotics. Now, apple cider vinegar, though, yes, that, when you put in vinegar, it's just giving you the flavor. Now, apple cider vinegar, if you picked up some raw apple cider vinegar, you'll see that there's a sludge on the bottom there, right? That's called the mother. That actually is your living probiotic in there. So apple cider vinegar has probiotics in there, right? As opposed to your white distilled vinegar that has nothing in there. It's distilled, there's no probiotics in there. So you can put that into cover pickled cucumbers with it, and it will taste like pickles, right? But it won't have the probiotic power of a true fermented pickle. Okay. Now, just know that it can take 30 or 40 times to try a food to actually find it acceptable. So we just keep trying, right? And there is something called flavor learning, which one of my friends recently told me about. It's where you pair a food that you're trying to get into your diet with a preferred, really desirable food, or something that you love, just a little bit, so you have that positive mental association with that food that you love. And eventually, if you pair it enough and you flavor learn enough, you can start to enjoy that food that you're trying to get in. So my friend, she put, her kid loves ketchup, so she put a little bit of sauerkraut juice in her ketchup. And then just slowly added more and more into her ketchup. And eventually her daughter's like, you know what, I kind of like sauerkraut now, right? So it's doable, right? All right. We also want good fats for our brain. This is for our brain. 60 to 75% of our brain is made of fat. Our brain is kind of squishy, and it has lots of fat in it. No low fat diets, please. But we want healthy fats. 80% of all the DHA in our body is found in our brain. What is DHA? That's docosahexaenoic acid. It is the omega-3 essential fatty acid found in fish oils, found in breast milk. We need healthy fats for optimal brain function. And in fact, those omega-3 fatty acids also act as food for our gut microbes. They can act as prebiotics, so they support the gut and the brain. And it is one of the most common nutrient deficiencies in children and adults. Dietary deficiency of omega-3 fatty acids has been linked with a whole host of mental health concerns and disorders. So where do we get our healthy fats? The best sources of our omega-3s are going to be fatty fish, like salmon, mackerel, herring, sardines, anchovies. We want to be mindful of getting sustainably caught fish when we can, right? Our fish are overfished, and we want to make sure that our fish are around for a long time. And also, unfortunately, now our waters have become so polluted that a lot of fish are contaminated with mercury and heavy metals and dioxins. So you want clean sources, wild fish. And that's not going to be accessible to all. And so a fish oil is often needed as a supplement. Oysters, caviar, fish eggs, seaweed are all good sources. You can get your omega-3s from some nuts and seeds, as vegetarian sources. However, with the caveat that many of us have a hard time converting the omega-6 in vegetarian sources like flax seeds and chia seeds and walnuts into the beneficial omega-3 essential fatty acids. So it's not an efficient way, especially if you need more brain fuel, especially if you need more fatty acids for your brain. The best way is really to get it from those fish sources. Vitamin D is one of the most important, vitamins. It's actually a hormone, not a vitamin. But for our brain and for our gut, again, it can act as a prebiotic fuel for the good gut bugs, and so important for brain function. It protects the brain, improves mood, anxiety, depression, attention, and focus, reduces inflammation, important for anyone with immune system disorders. We know that, kids with, ADD or autism also have a higher incidence of eczema, asthma, all those immune concerns. And low levels of vitamin D have been found in many different mental health concerns and neurodevelopmental concerns. So we want to optimize vitamin D. It is one of the most common nutrient deficiencies in children and adults. So important that I wrote a blog article on it called Why All Kids Need Vitamin D. Okay, it is so important to optimize our vitamin D. Now, what are the food sources? Well, you can get it from the sun. It's a sunshine vitamin. But if you're in the northern hemisphere, like most of us are right now, it's really only during the summer where the sun's rays are at the right angle, strong enough to get the conversion through our skin. So every other season, we need to make sure we're getting enough sources of vitamin D. So what are those? Cod liver oil, you could have liver, fatty fish, eggs, caviar, mushrooms. And some of these, cow's milk and dairy products often are fortified with vitamin D. And like I said, a lot of my patients are sensitive, so that's not typically the best source. But these aren't typically the most kid friendly, of food. So most people do need supplementation. I would, if you have the opportunity, ask your physician to order a 25 hydroxy vitamin D blood test, because it is shocking how low some people can be. Okay, and the range of normal is 20 to 100 nanograms per milliliter. And, I would want to know what that number is, because I've had patients come, where their outside doctors ordered the test and have been told, oh, your vitamin D level is normal. And they're a 22, which is definitely not optimal, right? In integrative medicine and functional medicine, we look not just at what are you in the normal range, what's normal, but what's optimal. Okay. And the optimal vitamin D range, in my experience with my patients, is right around 60 to maybe 80, right? So even if you're at a 22 and that's normal, if you're having eczema or asthma or anxiety or depression or ADD, it's not optimal. All right, magnesium it's really one of the miracle mineral. And again, I highlight these because these are so commonly deficient or insufficient in children. Magnesium relaxes the body and the mind. And when signs of magnesium deficiency can include mood concerns, attention concerns, behavior concerns, but also, constipation, muscle cramps, headaches, asthma. Why? Because magnesium calms things down and it relaxes muscles. Okay. So where can you get magnesium from food? We can get magnesium from our nuts and our seeds and avocados. Dark chocolate is a good source of magnesium. Legumes, beans, okay, whole grains. Those are all really good sources of magnesium. Now, that being said, a lot of my patients do need extra magnesium, and I do follow with blood levels. But magnesium is one of the safest minerals to supplement. The biggest quote side effect is if you take too much, you get a little diarrhea. So then you back down. Okay. Okay. Now, what about the foods that cause mischief to our microbiome, right? What I call those microbiome mischief makers. Well, there are a lot, but there are two that I'm going to talk about and highlight, because these are the most common things that our kids and even us as adults might be exposed to and not even realize, okay? And so keeping out the wrong things. Now, some of you may have heard of the SAD diet, the standard American diet, which when I was lecturing in Australia, they said it's the same thing down here, the standard Australian diet. The SAD diet is an ultra processed diet, supersized, fried foods in highly inflammatory seed oils, and trying to be healthier, having the sugar-free stuff, right? Like this Diet Coke Plus is off the market now, but I snagged a picture of it because this one, the FDA made them take it off the market because they're trying to market it as healthy. This Diet Coke Plus with added vitamins and minerals, like, that's not going to cut it. Okay. So let's talk about FDA approved food additives. These are additives that the FDA has said it is okay to put into your baby's formula, into your baby's food, your, packaged foods, all of these foods and even foods that we might think, you go to Trader Joe's or Whole Foods and you're looking, you're like, oh, this looks pretty good. Okay. There are some that are better than others, but there are some that really we want to avoid because some of those food additives cause direct harm to your gut microbiome and to your gut lining. So the key is be a savvy. I talk to kids about being a gut hero label detective. Read those labels. There should be as few ingredients as possible, and you should know every single thing that's on the label. If you can't pronounce it, or you have to Google, what is this thing in my packaged food? Don't buy that one, okay? Choose the other one. Also know that ingredients are listed in the order of predominance. So the first few ingredients are in highest quantity, okay? Now, we want to eat real food, okay, when possible. Ultra processed foods that go through many, many cycles, in a factory, are associated with mood disorders, ADD, anxiety, depression, cognitive decline. Ultra processed foods during pregnancy might increase the risk of ADD in your child. It only takes 2 months of a steady diet of ultra processed foods to lower your neurotransmitter levels. Okay. 4.5-year-olds who ate a quote junk food ultra processed diet were much more likely to have behavioral problems when they turned 7. Right. It's also not ever too late to change, though. Just 2 days within 48 hours of eating a healthy, clean diet can shift your microbiome to a healthier level, right? So it is never too late to change. Now, I'm not going to say never ever eat out of a package because I wouldn't be holding true to what I do, right? Yes, I buy packaged food, but I look minimally, but this is real life and we are busy. And life, there are many, many convenient packaged foods out there, but there are better ones. So know what's better and better. Okay, this requires reading the labels. My son, I give Takis as an example because he's 11 and all his friends love Takis. So he wants to eat Takis. I'm not knocking, if you.
I'm checking in for a second because I think we just lost.
Okay, I'm back. I apologize for that. Is that?
Yep, you're back.
Oh my gosh, this technology today. Okay, I'm going to go back.
Okay. So what we last heard you say was, I'm not knocking Taki's butt.
Okay. Well, I am knocking Takis, but not you as the buyer of Takis, okay? Because this is just all information, right? This is what we have to know, and we only know what we know at the moment, okay? So when you look at Takis, so my 11-year-old son, I mean, he wants these because all of his friends eat them. We all know that drill, right? So I just asked him, look at the ingredients, right? Let's look here. Monosodium glutamate, that's MSG. There's artificial.
This is a good time for deep breaths.
Well, and we'll check in. I suspect we've got a tech issue that's larger than the computer, that has to do with the universe and the environment out there.
Yeah, AKA weather.
AKA weather. So let's do this while we're waiting for Elisa to find her way back. Let's check in with everybody and do a little debrief. What are you getting so far? Oh, she's trying to get back in. Hold on. Capture in the chat while we're waiting for her to get back on track. What are you taking away so far from this conversation? What insights are you having? And
I am back. Boy, we all need some deep breaths right now.
That's what Laura just said. And I want to check in with you on time because we've got 15 minutes left.
Okay,
so
I will
want to make sure you're aware of where we are as well.
Absolutely. Okay.
And I've invited everybody to start capturing in the chat some of their insights and what they're taking away so far. So that'll give us something to kind of use as we move towards completion.
Okay, perfect. So you just want to look at the labels. I mean, look at all of these. I would have to look up most of these ingredients here, right? Then you look at the Trader Joe's version, and it's better. It still has, I don't know what natural flavor is and maltodextrin, not sure why it's in there, okay? But then here, these Pockies are, yes, it has a maltodextrin, but even better, okay? So just being a savvy label reader.
Oh. Oh.
I think we need to skip that topic and just move on.
Let's, I have no idea what's going on. I'm even wired. I don't know if the rain has started or not, but I apologize, guys. Okay.
So I think the fast food is giving us a run for our money.
Yeah, let's move on, but we're going to talk about sugar, which is not another topic.
Because that's so much better, right?
But added sugar, I'm talking about added sugar, because we are eating more added sugars than ever before. And sugar causes inflammation, and it can impact our mental health capacities, right? Sugar, too much added sugar has been found to worsen anxiety and our ability to cope with stress, and it's addictive. Problem is, it's found everywhere. And just know there's no nutritional benefit to eating added sugar. Now, sugar tastes good, right? There's pleasure in eating sugar. So I'm not saying no sugar, but we want to keep it down. So kids really, and this is adults or someone, shouldn't have more than 25 grams of added sugar a day, added sugar. Now, added sugars can be a little sneaky in ingredients, but 25 grams is about 6 teaspoons of sugar, right? Of added sugar. But it's sneaky and it adds up, because when you look here, if you're thinking 25 grams of added sugar, I used to buy Greek vanilla organic yogurt for my child, thinking this is a great way to start the morning. And then I actually looked one day at the label, 15 grams of added sugar. That's almost 4 teaspoons right there. And that's almost all of their intake for the day, right? And then you have your sandwiches, your bread, and your jams. So just be savvy and read and try to keep that down. Your kid's brain will thank you for it. Your brain will thank you for it. Sugar-free is not necessarily better though, right? All of these artificial sweeteners can cause just as much disruption to the gut microbiome. And in fact, maybe more addictive. There's saccharin was chosen by rats who were addicted to cocaine over the cocaine itself, right? And acesulfame potassium has been found in mice to really affect their brain functioning. So these are the fake sugars to avoid. Saccharin, aspartame, acesulfame potassium, sucralose, which is Splenda, neotame, advantame. So I prefer having the real sugar or maple syrup or honey, just keeping it to a lower level. Okay. Now, sometimes food isn't enough, and sometimes your kids or you may not have the most varied diet just yet. So supplements can be really helpful. So these are the very common supplements that I will use to help support kids' moods and adult. This is same goes for adults as well. So your fish oils, your vitamin D, magnesium, probiotics, and there are some other supplements called inositol, L-theanine, and GABA that can be very calming to the nervous system. So these are ones to just take a look at and see, can these support you or your child as you're trying to clean up your diet and support the gut-brain connection? Just know that it is virtually impossible, and I would say really impossible, to out-supplement or out-medicate a poor diet and lifestyle. It's going to be an uphill battle. So the more you can do to just step-by-step every day move toward a gut-friendly, brain-friendly diet and lifestyle, the better the chance is that everything you're doing is going to be successful. Now, how do we then go the opposite way? How do we support our brain and the vagus nerve? Remember that bidirectional highway communication to support optimal gut-brain connection. I want everyone to view mindfulness as medicine. It's often takes second place or third place or fourth place or fifth place behind medicines, supplements, trying to change your diet. And it is possibly the most important thing we can do. Now, something called heart rate variability is a measure of vagus nerve function. And we want good heart rate variability. We want optimal heart rate variability. Happiness, positive emotions, and having optimal heart rate variability is associated with an improved gut microbiome in children, as opposed to high levels of stress and low vagus nerve function is associated with lower microbiome diversity in children. Same goes for adults. And get this, it is independent of diet. So even if you're not able to change your child's diet yet, or your diet yet, if you work on the mind and focus on the vagus nerve, you will help your child's gut microbiome. You will help your gut microbiome. So what are ways that we can optimize vagus nerve function? We can do cognitive behavioral therapy, right? That is a cornerstone for treatment of anxiety for children, for teenagers with anxiety. Mindfulness, meditation. There's an app called Heart Math, which helps train your heart rate variability. Belly breathing, the slow breaths in and out, not with your shoulders up here, but down with your belly. Practicing loving kindness meditation or gratitude. Laughter, laughter yoga, do goat yoga, and puppy yoga, whatever it takes, but laughter helps. There's something called emotional freedom technique or tapping that also has been shown to optimize heart rate variability, optimize vagus nerve function. And all of these that we might think are optional, and we'll get to this when we feel better, are really what I think are the keys to getting yourself to feel better and supporting your gut microbiome so you stay feeling better. I love Don Huebner's books. Don Huebner is a child psychologist who's written a whole series of quote self-help books, teaching kids cognitive behavioral tools that can increase their heart rate variability. These are some of her older books. The What to Do series, What to Do When You Worry Too Much was her first book. Outsmarting Worry is a great book for older kids to learn how to manage their anxieties. Yes, love them, right? What to Do When Your Brain Gets Stuck is for OCD. What to Do When You Grumble Too Much for negativity. Now, she also has a brand new series of book called Mini Books for Mighty Fears, which is an amazing series as well. That's her brand new series, just released in 2022. You can practice mindfulness anywhere, right? And for children, it can just be that mindful moment. There's something called a 5 senses meditation that is so powerful to teach kids how to just stop in the moment, use all their senses, right? To look, listen, stop, look, and listen, right? And notice what's going on around them and in them. And it's so powerful. And you can just look up it just in the essence of time. I mean, you can look up 5 senses meditations. When you start, you want to close your eyes first because our visual input is our strongest, and you really want to listen and smell and taste and notice what your skin is feeling before we open our eyes and notice what we're seeing. There's an app called Insight Timer that is a free meditation app that has amazing meditations from experts from around the world. There's other apps too that have free and paid options. Oak app, like the oak tree, is one that one of my patients told me about. It's a breathing app, and so he loved it, and it's a very simple app to follow with breathing and mindfulness exercises. And then this is my favorite one. To have kids download if they have a phone in my office, our parents download. It's on Insight Timer. It's a 5-minute breathing meditation by Megan Winkler. What an amazing way to start the day. A lot of us feel like, I go. I don't have time for a 90-minute yoga class. I don't have time to sit down and do a half-hour meditation center. This is 5 minutes. And I tell kids and parents in the office, if you don't have time for 5 minutes, it's because you don't want to, right? It's because you're not making it a priority. So let's make it a priority. Loving kindness meditation, just repeating these 4 simple sentences. You can do it at bedtime with your kids. You can do it at dinner time when you're expressing gratitude, but extending to yourself and to those around you. Loving kindness and letting everyone know, letting yourself know, may you feel safe, may you feel happy, may you feel healthy, may you live with ease. Those 4 sentences practiced daily has been found to improve vagus nerve function and improve positive emotions. Belly breathing with that belly, diaphragmatic breathing, slower on the exhale than the inhale, has been shown to improve heart rate variability, improve mood, improve stress response, lower our stress hormone levels. Really important. I mean, and a lot of parents in my office, when I'm teaching kids how to do belly breathing, they're sitting there trying it, and it's so hard not to move your shoulders because we've been taught to kind of suck it in and keep our bellies tight. But this is you just want to let everything relax. And there's a really cute Elmo video on YouTube with rapper Common and singer Colby Kelly on teaching little kids how to belly breathe. I mean, these 8 to 10-year-olds in my kids' 3rd and 4th grade classes loved it. Super cute. And then tapping. Tapping uses different, acupuncture points with positive affirmations to reset your vagus nerve, reset your nervous system, and has been found to improve that vagus nerve function and also improve mental health concerns and anxiety. There's a free app, the tapping solution, that anyone can download. So that's it for the gut-brain connection. I hope you guys got some good takeaways and some food for thought, maybe learned some things that you hadn't known before, or maybe reinforce some things that you had already known. So I apologize for all the glitching. Hopefully, hopefully that everything came across as it was meant to.
Wonderful.
Beautiful, beautiful. Lisa, thank you so much for this presentation, for not only the information and the data, but for your energy and the way in which you bring yourself and your work into your presentation. It's really quite delightful. Thank you. I want to invite those who are listening to capture in the chat sort of what are your insights, what are you taking away, or if you have any questions. There have been a couple of questions. If you have just a minute for one or two, are you open for that?
Sure. Yeah, absolutely.
Great. Somebody asked, I've read that supplements mostly die or don't make it through our digestive system. Can you speak to that?
So I'm guessing
supplements.
probiotics mostly die then, right? There are probiotics now that are, the capsules are enteric coated so that they do make it down into the lower tract. I'm guessing that's why the dye is there, because probiotics are living organisms. There are also spore-based probiotics that can survive the digestive tract. And, I know I do lots and lots of poop testing in the office. And so I do know that many of these probiotics can go down, reach down to the large intestine and colonize and have some good results.
Great. There's been a recommendation or request for what probiotics you recommend, because there's so many different kinds. Anything you would add to that?
So Adrena, I see popped on. Hi, Adrena. I didn't realize she was here. Adrena is my amazing admin. So there are lots of different ones. You want to make sure that there are as many different strains of probiotics as you can find, because of the trillions and trillions of organisms out there. It doesn't make sense to just take, a probiotic that has 1 or 2 strains, unless you're using it for a very particular purpose. So I typically use one that's, quote, broad spectrum with lots of different strains. So I do use one by Claire Labs called Therabiotic Complete. I use others as well, but that's one of the more common ones that I use. What's interesting is now some companies are actually packaging particular specific psychobiotics, right? Those probiotics that help support serotonin and dopamine and healthy neurotransmitter levels. And Claire Labs does have one called Target GBX. That stands for gut-brain axis. So it has strains that specifically have been shown to support healthy levels of serotonin and dopamine. So Target GB-X. And that one is, that one only comes in a powder, because that was the form that it was studied in to be effective.
And can you speak a little bit to shelf stable versus refrigeration?
So if it's shelf stable and doesn't have to be refrigerated, then that means hopefully that manufacturer has tested the probiotic to be stable for the duration through the expiration date. The expiration date just means that the number of colonies of probiotics that are in the bottle are on the label.
You want to sell on
still guaranteed to be there, by up to the expiration date. And it's not that at the expiration date, boom, all of them die, right? It's just that after that, they don't guarantee it.
Right.
But there are some non-refrigerated probiotics now that are more shelf stable, again, because they figured out the technology to make sure that they remain stable through the expiration date.
Great. So Elisa, Dr. Song, I want to thank you. I know we've got people here before everybody leaves, because we're at the top of the hour, and I really want to honor everyone's time. I want to, first of all, thank you and your amazing administrator, Adrena, for everything that you did to make this presentation happen today. It's been wonderful. It's been, I think, what a lot of us needed. For some of us, some reminders, lots of new information, and all with a beautiful generosity. So thank you. I want to
Thank you for
remind
having
those
me.
of you, truly a pleasure. I want to remind those of you here two things. One, the Powerful Project is a volunteer-only organization. It's all volunteer-run. Your donations make a difference and allow us to do things like this and to support individuals with mental health support and resources. So you can go to powerfulproject.org or Venmo at powerfulproject99. Please make a donation of any amount that you can to support us in providing these presentations. And heads up, the next event is with the Ninja Warrior, Jen Liam, talking about emotional and physical wellness for teens, college students, adults, how our bodies hold anxiety, trauma, and grief. And it's going to be a great presentation. So sign up. You can start signing up now. Can we put the link in the chat, Lauren?
Possibly. That's going to be on May 10th.
May 10th?
And in the evening. And I
So-
believe 7:30 p.m.
So
something like that.
join us again. Those of you who have registered for this event, whether you're listening now or attending live, you will receive access to be able to listen to this recording again. We invite you to share it with others, encourage others to make a contribution to the Powerful Project, and to join us in this speaker series as we raise awareness for health and mental health and ultimately making the world a better place. So Lauren Foster, thank you for all you do to make the Powerful Project the most extraordinary positive environment that it is. Dr. Song, thanks for being with us today. And for all of you here, thank you for what you're doing for yourself, for your family, for your communities. The consciousness that you bring makes a difference day by day. Take care, everybody.
Bye, everyone.